To question 13, I call on the Honourable Member for Arbory, Castletown and Malew, Mr Glover.
Thank you, Mr President. Seek leave to ask the Minister for Health and Social Care how many people are suffering from long COVID and whether there is capacity to treat them. Thank you.
Minister for Health and Social Care to reply.
Thank you very much, Mr President. Although most people with COVID-19 get better within weeks of illness, some people experience post-COVID conditions. Post-COVID conditions are a wide range of new, returning or ongoing health problems people can experience more than 4 weeks after first being infected with the virus that causes COVID-19. Even people who did not have symptoms when they were infected can have post-COVID conditions. These conditions can have different types and combinations of health problems for different lengths of time. Commonly referred to as long COVID, this is a range of symptoms that can last weeks or months after first being infected with the virus that causes COVID-19, or can appear weeks after infection. Long COVID can happen to anyone who has had COVID-19, even if the illness was mild or they had no symptoms. A recent study by the University College of London identified people reporting over 200 symptoms of long COVID, affecting 10 different organ symptoms. People with long COVID commonly report experiencing different combinations of the following symptoms: tiredness or fatigue, difficulty thinking or concentrating, headaches, loss or long-term changes in senses of taste or smell, dizziness on standing, fast beating or pounding hearts, chest pain, coughs, joint or muscle pain, depression or anxiety, fever, symptoms that get worse after physical or mental activities, specific organ dysfunction such as long-term lung damage, gastrointestinal symptoms and cardiovascular problems. The majority of people with any of the symptoms that can be associated with long COVID would be treated through the usual pathways that already exist for treatment of these symptoms. However, some patients present in a complex manner, especially around fatigue and related issues, and in these cases, people will be referred to the Manx Care Long COVID service. Currently, the Long COVID service is delivered by 2 senior therapists working from the Community Adult Therapy Service. There are currently 6 patients on their Long COVID caseload, with 3 on the waiting list. The business case was submitted by Manx Care and the Department of Health to Treasury in August for consideration to establish an expanded service that encompasses both ME and CFS and Long COVID, and an outcome of this bid is awaited.
Supplementary, Mr Glover.
Thank you, Mr President, and thank you to the Minister for his reply. But as has been alluded to already on a previous question, an Office for National Statistics survey across estimated 1.3 million people in the UK have long COVID, and 40% of those surveyed had COVID-19 for more than a year previously. Is it safe to say that we are likely to be on a par with that? Because part of the question was, do we know how many sufferers we have here? Thank you.
Minister to reply.
Thank you very much, Mr President. The ONS survey was a self-reporting survey, and it's defined actually by the ONS themselves as an experimental set of statistics. It is probably quite sensible for us to base our long COVID service capacity on similar figures, but actually to date we have no further evidence other than what I've described, which is the number of people actually seeking to access long COVID services. The reason I tried to out some of the more complex areas of symptoms is because there will be undoubtedly a lot of people suffering from those symptoms, which are as a result of long COVID, who may not need to access a dedicated long COVID service. They can be treated through the regular pathways that already exist. So in order to get a comprehensive data set of that man, I think we would have to be questioning every single person accessing healthcare as to whether or not they themselves believe it to be long COVID. I don't think that's realistic. I think what matters is people getting the treatment that they need, which involves making sure the GPs have the resources they need to correctly refer people into the long COVID service. That is all work that is being undertaken. So I can't really don't remember any more numbers other than what I've already said, which is we have 6 people currently accessing the service and 3 more on the waiting list. I do expect those numbers to be higher, which is why we've put in that business case for an expanded and more comprehensive service, because we do need to make sure that the capacity in the system will match any eventual need.
Supplementary, Mr Mercer.
Thank you, Mr President. Further to the answer given by the Minister just earlier, will training be provided to the 2 senior clinicians who currently work with the ME, CFS and long COVID populations, and if so, when? And when will the same service start providing diagnostic support to GPs? Thank you, Mr President.
Minister to reply.
Thank you very much, Mr President. Updated guidance will be getting sent out to GPs this month in terms of referral and support and diagnostic support. There will be formalised training for GPs in their March training session, which will be provided by a UK specialist. There was another question in there, I think, in terms of further guidance. Basically, everything is in train, everything is moving as quickly as we can make it move. But I think the Honourable Member is completely correct when he identifies the fact that we need to make sure that our frontline responders, i.e. our GPs in this space, have access to the adequate resources and training that they need.
Thank you. Supplementary, Mr Glover.
Thank you, Mr. President. I could give you, those numbers you said and you expect to grow seem incredibly low from the response I've had since putting this question. And I could mention, and already have had discussions with the Minister on some cases that I'm aware of. One, a young child who is now wheelchair bound, having suffered from COVID, and indeed one only this morning from the family of the first person that was admitted into Noble's Hospital during the pandemic and went into ICU. They survived, but at the age of 52 are now classified as disabled. So I really would urge that this is a bigger problem than is currently it would appear on the surface, and would ask the Minister just to re-emphasise what he's planning to do to raise public awareness of long COVID so that people can indeed go and seek help. Thank you.
Minister to reply.
Thank you very much, Mr. President. I think long COVID is very much in the public consciousness. I don't really think there's much more that needs to be done to make people aware of this condition. I think it is widely acknowledged that long COVID exists, that people can and do suffer from it. I think the Honourable Member is completely correct in terms of the potential scale of the demand out there. Whether that demand is all focused on a dedicated long COVID service or spread across existing support pathways is another question, I suppose, which again is the whole purpose behind the business case we've submitted to drastically expand the service that's being offered. Other work going on, as well as providing information leaflets for the public, which have been prepared and finalised last week, is my understanding. Again, they'll be available online to help people self-identify and self-manage some symptoms. There are also plans to develop an online self-help package for those suffering with chronic fatigue. That again has been sourced by our consultant clinical psychologists, being finalised, and we're going to be hopeful to point people to all this kind of information via the COVID website, via our own websites. The other thing I would suggest is the UK has a wealth of resources around long COVID, not just in terms of what they offer in terms of treatment, but also in terms of self-management and how people can help themselves get back to work, get back on their feet and manage their condition. And really I would encourage people to have a look at the NHS guidance on this. It is pretty good, it's quite comprehensive. There's a website called yourcovidrecovery.nhs.uk which lays out quite a lot of information around how people can help manage their own condition and how they can improve their own situation, and also the kind of questions they might want to consider asking their GP if they do feel that they are suffering from long COVID or post-COVID syndrome.
Supplementary, Lauder.
Thank you. Large portions of my question have been sort of covered by Mr Mercer and Mr Glover. I would just perhaps ask the Minister that, given the shortage of GPs that we have at the moment, and given that people are still being discouraged from going to GPs for relatively minor ailments, and much of what he's described in terms of fatigue and things would tend to be considered by individuals as being relatively minor unless they persisted or were significant over a long period of time. I would suggest that there would be significant underreporting at the moment of people with long COVID. So I really do welcome the GP education point, but could he make sure that people will be encouraged, and that pharmacists will be encouraged to refer people to the GP if they suspect that long COVID is a factor in what seems on the face of it to be sometimes relatively minor ailments?
Minister to reply.
Thank you very much, Mr President. I'd like to thank the Honourable Speaker actually for making that point. There are a wide range of services you can access yourself to get advice. Pharmacists are a good example of that, GPs, the MIU. Quite helpfully, the health service do talk to each other. And it is quite a regular occurrence that a pharmacist will refer you to a GP if the issue you have is something they don't think they can assist with, and of course vice versa. So the message that he's given out there is people are being advised not to go to their GPs. That's not correct at all. We're trying to advise people to go to the most appropriate place to seek treatment, which often will be the GP as a first point of contact. So I would encourage anyone who thinks they may be suffering from long COVID, please do contact their GP and please do have that conversation with them about potential treatment and support options.
Supplementary, Mrs Christian.
Thank you, Mr. President. I would argue with the Minister that we actually really do need to raise awareness in the support that's needed. The Manx Care Long COVID service hasn't been widely reported, and clearly what we're seeing here, or what I think we're seeing here, is that referrals are rare, and this is because the GPs haven't been given the right support. And I'd like to ask the Minister, why has it taken 2 years to give the GPs this support? And I mean, I'm hearing things like where GPs are declining to offer to help. Their advice that they're giving is too vague. They don't have enough information. And maybe this is why the referrals aren't coming through to this service. I'd really like to hear from the Minister if he could just clarify that pathway. Is he really sure and really thinks that that pathway is robust as it is right now? And if it isn't, what is he going to do to make sure it is? Thank you.
Minister to reply.
Thank you, Mr. President. I think I've already outlined the plans to expand the service quite drastically. I can't comment on why it took 2 years to get here. I've only been in post the last 3 months. It's quite difficult to explain, I think, some of the delays we've seen. A lot of issues, if I'm perfectly honest. But in terms of this particular service, again, I can't comment on GP referrals. I'm a layman. I'm able to find quite a lot of guidance and information available on the websites from the NHS, from various individual trusts. I'd be very surprised if GPs themselves aren't capable of doing this. GPs themselves obviously keeping up to date in terms of the latest guidance and nice recommendations in terms of treatments and pathways and referrals. So if anyone does have any particular issues accessing any of these services, I would encourage them to reach out to the MCALS service, that's the Manx Care Advice and Liaison Service, report their issues, ask the questions they want to ask, and they will be provided with support and information. But in terms of can we raise awareness of this any further, I think this is the 4th question I've answered in this honourable court about long COVID. It's quite regularly reported on Manx Radio and in the newspapers, not just here, but also on the BBC, an article this morning. I think it is quite widely disseminated, the information that this condition does exist. It is quite broad, and people are being advised to try and seek support and help where they can, which again comes back to Mr. Speaker's point around picking up the phone, talking to your GP, talking to your pharmacist, and actually doing a little bit of research yourself, perhaps, to access some of the readily available free online resources from the UK NHS.
Mrs. Masker.
Thank you, Mr. President. Would the Minister agree with me that prevention is better than cure, and this emerging evidence reinforces the message that should be going out that vaccination is one of the major tools that we have at our availability, and to encourage people that long COVID is a real condition that can threaten their future, and vaccination is in our armoury, and people really need to take this opportunity at every stance. Yeah. Thank you, Mr. President.
Minister to reply.
Thank you, Mr. President. I would completely agree with the Honourable Member for Council with that. The vaccine, I think, is the single biggest thing any one of us can do to help stop us catching COVID and stop us suffering these symptoms in the longer term. I'd also say that over 70% of people on the Isle of Man who are eligible for a booster have now taken that opportunity and have had their booster. So if you are one of the holdouts, you are very much in the minority. I would encourage you to get down to the walk-in vaccine clinics as soon as possible to take up that offer for a booster.
And final supplementary, Mr. Glover.
Thank you, Mr. President. And could I ask the Minister, he's stated obviously a large range of where to go and find out information, that we have that more locally available, as opposed to people being asked to look it up themselves by doing a Google search. And also just a plea that there was a promise made by his predecessor in relation to ME sufferers, and I bring them in because obviously it's often being compared with similar symptoms, that there would be a new time frame on delivery of improved clinical practices, and the deadline of that was actually the 31st of December 2021, which of course has now been and gone. But I plea that we really look at this in the round, long COVID and ME sufferers, and look to really improve, one, the information flows, but two, the clinical procedure and the routes, the pathways. Thank you.
Minister to reply.
Thank you, Mr. President. The Honourable Member is completely correct. So yes, we have produced a local leaflet that will be available for people. I've asked if we can place that on the COVID website with a dedicated section to actually some of these other resources I've mentioned as well, so people have that single point of reference where they can go to and say, actually, this is where I can access a lot of these readily available resources. In terms of the ME and CFS service, I just caution members a little bit There are some similarities. Obviously, in some aspects of long COVID do overlap with some of the symptoms you would see in ME or CFS sufferers. The two conditions can, however, be quite different. And so whilst there will be an overlap in terms of service delivery, and actually a lot of the support in place will be that cross-therapeutic, multidisciplinary support that's needed, the two conditions are not interchangeable. And I'd just like to caution members around some of that.